about the River State Contributory Health Insurance Scheme, which has which was kick-started. Let me put it that way. It has started. We saw in the news yesterday the governor and his deputy registering for the scheme, and we talked about it one time. I think I was on the Morning Crossfire at the time, and we talked about it. But we want to revisit the conversation, most especially because we want Rivers people to know how they can benefit from this scheme. And for us to have a good conversation on this issue, a robust one that is educative, I have decided to invite the Acting Executive Secretary of the River State Contributory Health Insurance Protection Program. I'm talking about Dr. Vetty Agala. Doc, you're welcome. Good afternoon to you.
Good evening, Canada. Good evening, everyone. I'm happy to be here.
All right. So let's do a quick revision. I just realized that the last time you and I had a conversation on this, it was on the morning show. So now you're on Hard Facts. So can you please tell us this scheme, this insurance protection program, health insurance protection program, how does it work? What is the intent of the River State government? What are the goals and the visions for this scheme? Can we hear you, please?
Thank you, Canada, and thank you, Nigeria Info, for having me on the call.
Okay.
The health insurance for River State is called River State Contributory Health Protection Program.
Okay.
So that's the name of the agency. It's actually an agency, a parastatal of the Ministry of Health. And we are charged with making sure that Rivers people, everyone that lives and works in River State, can have access to affordable quality, how be it basic health care when they need it, without having to pay out of pocket at the point of service, right? Now, our mandate to make sure that we reduce the number of people that are paying out of pocket. River State has over 90% of the population paying out of pocket, and that's not okay. It is one of the targets of the Sustainable Development Goal 3, which is health for all. We have universal health coverage as one of the targets. And one of the things we look to is to ensure that people can access care without being impoverished while trying to take care of their medical needs. And so the River State Governor, Siminalayi Fubara, approved the implementation of the health insurance law that has been in place since 2021, as signed by the former governor of River State. That law had been there but was not implemented until this administration deemed it fit to implement that. And now, what does that mean for Rivers people? It means that everyone that lives and works in River State can sign up to our health insurance plan and program and be able to pay a premium if you can pay, and if you belong to the vulnerable population, to have the government pay for you. So in a nutshell, that's what we are doing, providing financial risk protection for the people that live and work in River State.
All right. Now, you've just mentioned something very critical. How do we determine who is vulnerable in River State? Can you help us define vulnerable?
Well, so every state or every organization decides who they want to use as vulnerable, what criteria they want to use. Now, nationally, there's a social register. The state coordinating unit goes around, takes data, checks where people live, what they have in their homes, all of that, and come up with the social register. But beyond that, states also decide that people that are no longer working, they're in the rural area, but they are aged, 60, 65 and above, they are part of the vulnerable population. Our maternal mortality is still very high, and so pregnant women in our communities are also classed as vulnerable population. We have children that are under 5. We have orphans and vulnerable children from different organizations from different diseases that have been orphaned. We also have persons living with the structures we're using. Those are the indicators that we're using for now. Because those in the community know those that are vulnerable amongst them.
Right.
The religious leaders know, the traditional leaders know. So we triangulate these data and these populations, and then we're able to come up with those who we would define as vulnerable. So every state, every organization defines their vulnerable group.
All right then. Okay. So this financial insurance, or rather, this health scheme, let me put it that way, is it open to non-indigents? Because in Nigeria, we always have this, separation of indigents and non-indigents. So people who are not from River State, are they also going to benefit from this River State health insurance?
Absolutely, Canada. Like I said, it's for everyone that lives and works in River State.
Okay.
Everyone that lives and works in River State. Now we have different plans. So what the plan that we flagged off is the vulnerable group plan, where government is paying both the federal government and the state counterparts under the Basic Healthcare Provision Fund. Right. Now, aside from that, we also have a plan that is the informal sector plan for anybody. You're not working for government, you're not working anywhere, but you're an individual, you're a family. You can buy into the health insurance. You pay a premium and you access healthcare for 1 year. All right? So if you live and work in River State, whether you're a market woman, whether you're a vulcanizer, whether you are a trader, whatever it is, a farmer, and you do not belong to this vulnerable population, by the standards that we have given, the indices that we have written out, then you can have access by paying a premium. Now, the concept of health insurance is a pooling system where we pool together our resources and we pool together our risks as we do so. So you find that those who can pay more for health insurance. Those who cannot pay so much, pay what they can pay. By the end of the day, you assess care based on your needs. So you find that the rich subsidize for the poor, the healthy population in between the children and the age, they subsidize for those in the extremes of age. All right? So you find that everyone finds a place. Now, another plan we have is for the formal sector. That's where government workers, whether at the state level or local government level, are signed up. And for them, they pay according to their level. Government pays a part, and then the employee also contributes. And that's the concept of the contributory. Because we are moving from a point of free medical in River State, where everything was free for everybody, and it wasn't sustainable, to where we are saying, okay, bring the little that you have. Let's pool our resources together, so that whenever any of us is ill, they can actually just walk into the health facility, access the care that they need without having to pay out of pocket.
Now, looking at this pool factor you mentioned, can I say the more I pay for insurance, how do I put this question now? There's a question in my head. Okay, so would the amount I pay determine the kind of health care I receive? In terms of, are there limits to the kind of diseases that can be catered for by the insurance?
Absolutely. So what we are running is a social health insurance program.
Okay.
It's not the private health insurance, something that we would do eventually. But for now, the governor's concern is the poor people. He wants to ensure that everyone can actually access care when they need it. He believes that those who already have, perhaps they are already accessing their care outside the country in places where they want to and the kind of care that they want to. But the care we want to give is basic health care of sufficient quality. So for this kind of social scheme, usually your package depends on the prevailing diseases around. Healthcare costs are rising. The cost of medication is going very high. It will be foolhardy for us to say, if you pay this amount, you can get everything. There is no health insurance that gives you everything. Usually there are partial exclusions and there are, total exclusions. And this is not different. But we assure you that the things that are killing our people, the malaria, the pregnancy issues, delivery, little things that are killing our people are covered under the scheme.
Okay.
And then if the primary care cannot provide the service, they refer you to the secondary level care. You can have surgeries, you can have blood transfusion. So our package is a total package. Even if it doesn't have some aesthetic things like you want to wear braces or you want contact lenses and all those kinds of things. No, the insurance will not provide for that. But the basic things that you need, dental care, eye care, simple illnesses, they are all covered.
You mentioned surgery. I want you to clarify on that. I want clarity on that part. When you say surgery, what kind of surgery?
Yes, so when you have a need for surgery, it's covered. Whether it's a cesarean section, whether it's a herniorrhaphy, whether it's an appendectomy, whatever surgery that you need is covered.
Interesting.
Under the scheme.
Oh, okay. I have a commercial break coming up, so I'm going to throw this question quickly at you, so you can give us a quick answer as well. So the insurance scheme is supposed to, give us access to health care. What facilities are we supposed to take this insurance to? Is it just the River State health facilities, or are there other facilities we can take the insurance scheme to?
All right, thank you, Kalada. We can't do much without the private practitioners.
Okay.
So definitely we know that a lot of people still do access care from private facilities. So we are not only using the government facilities, we are also going to use the private facilities.
Okay.
Now, this is very important because people are going to be paying. And so they will have a choice of where they want to access care. And we are ready to give them that choice. Okay? And we know that the health insurance system coming in will help to strengthen the existing system to make sure that even our public facilities, they rise up to the occasion, because they will be in competition with the private facilities to have lives that they are taking care of.
All right, so we'll go for a quick commercial break. Please do see on the line. I've got more questions for you, and of course, I believe the listeners also have questions for you. So when we do come back, we would have further conversations.
All right, sir.
Kala Dakurubat for 27 minutes gone past the hour of 4. And as guest on the show right now, talking about the Rivers State Contributory Health Protection Program is Dr. Vetty Agala, who is the acting executive secretary of that program. All right, welcome back, Doc. Welcome back, Madam. Can you hear me?
Thank you, Kalada. Thank you so much.
All right, so to my next question, we've seen contributory schemes in River State, or another contributory scheme in River State. During the Amechi's time as governor, there was the contributory pension scheme. And we saw the hurdles, the challenges. So what is this administration doing differently as it pertains to sustainability? How can we, or what has been put in place, what measures have been put in place to ensure that these insurance scheme, health insurance program, goes beyond the 8 years of Fubara's government?
Thank you very much, and thank you for recognizing that at least for as long as His Excellency Sir Siminalayi Fubara, JSSRS, is governor, and a governor that is people-oriented, that knows that this is the need, the felt need of the people. As long as he's there, this program is going to continue. But beyond that, the very structure of the program brings about sustainability. There's no health program that you're doing now without thinking health insurance. Now, beyond the contributory that was done before, where it was just between government and their workers, this time around we have private people's money in the scheme. And so you find that accountability is one of our watchwords. Now, God has given us the privilege to be the ones to lay the foundation for health insurance in Rivers State Health Insurance. And we're doing everything to ensure that we get back the trust of the people. So everything in place, accountability mechanism, we are innovative, we are flexible, we are meeting needs because we are people-centered and we are responsive to the needs of the people. We believe that if something stays true for 4 years and another 8 years, there's no administration that will come and stop it, because it's not solely dependent on government. It's a scheme that works with or without the government. Definitely, government has a huge role to play. There's a lot of input that government is making. And, I mean, this scheme it has a lot of political economy. So I don't see any government that will come in and will not see this as something that helps the people, the very people that he's coming to rule over, to govern. So I believe that sustainability is already ingrained in the workings of the health insurance. There is a law that backs it. It's not just a program that someone will come and do away with.
Right.
There is a law. Okay? So I believe it's something that has come to stay forever and ever. As long as there are people that have needs, there are people that need to access health facilities.
All right. So my next question, I guess everybody also would want to ask that question, is how can people living and doing business in River State register for this program?
All right, thank you, Kalada. We flagged off enrollment on Thursday last week. I think that was 11, and we started with Indoni. Now, that enrollment we did was for us to try and meet our target of getting the vulnerable population that government has decided to cater to, getting them on board. Now, we have a website which I will share, and our social media handles, and we're going to be out there on the media, all media. In fact, thank you, Nigeria Info, for bringing us out. But we're going to be on all media platforms. We're having campaigns in all the local government areas in all the world so that people can pay. Now, we have a system that is end-to-end. So you enroll and then you're able to pay digitally.
Okay.
Like pay at once. So the system is going to be very, very people friendly and open enough for us to be able to interrogate. We are very open to suggestions. There will be lines, complaints, management, all of the work. We're working on a system that really can bring back the trust of the people for the government and their welfare.
Okay. So if I want to register or enroll, I should go to the website or the social media handle. Which is it? Can you hear me?
Yes, through our website, we are going to have campaigns of enrollment. Like for our informal sector, we're going to be working with the different groups. So we're coming to organizations, we're coming to groups, Market Women Association, Drivers National Union of Road Transport Workers, all of those groups. We would prefer to work with them as groups, but individuals can actually walk into our offices. Our office is at the second floor of Block A, Waterline House, the remodeled Waterline House. So you can come to us, you can make inquiries. But like I said, you can also send us an email. We are info@rivchip, which is RIVCHPP .rv.org.ng. I'll send that to you, Kalaga.
Okay.
And then we have phone numbers that you can call. But our website is going to be where people will interact with us, those who can. But those of us in the rural areas, we're going to have to meet them where they are. And so our campaign trail will just be hitting your doorstep anytime from now.
All right. So for you listening, if you are in the rural areas, she's saying that the campaign will get to you, get to your doorsteps. But for those of you who are living in urban areas, you can go to the website. I think she rolled it out. I'll roll it out when I get it as a message. And you can also go on their social media handles or walk into the office. She said the new or the remodeled Waterline building. Go there and get the necessary information. But you see, it's very important that we get an insurance for health. I really experienced it recently. A friend of mine who died, a colleague as a matter of fact, did not have health insurance, so it was very difficult for us to tackle his ailment. So it's really interesting and really necessary that you get yourself the health insurance if you have not gotten one yet. And it's something that we want Rivers people to, I want Rivers people to key in, but I'm not working for them, so I shouldn't. But anyways, you get the point. So I'm going to open the phone lines now, 0817-923-0002 and 0817-923-0003. There is also the number 0817-923-0007. If you do have a question, you do have a contribution, I would like to hear from you right now. The question I'm putting out there is, what do you make of this health insurance program of the Rivers State government? What do you make of it? How do you think it can be sustained? And what do you think they can do to ensure that it benefits all of Rivers people? So I've got Clinton as my first caller. Clinton is calling from Bori. Clinton, welcome. What is on your mind?
My dear brother, good afternoon.
Yeah, welcome.
Good afternoon to your guests.
All right.
Yeah, what I want to say is that it is the primary duty of the government to provide affordable health care for the people. And now we have this contributory health scheme by the government, which is commendable. But again, accessibility to healthcare is one thing.
Okay.
Your guest talked about the private going to private centers, that they are partnering with private clinics. Again, these private clinics are not in some areas. So the public health centers that are supposed to be in the villages are not functional. So what I think the government should have done is to ensure that they put those facilities in place so that people can easily get access. Because if you go to the private center, which are in far distances, you pay a lot of transport. So they should try and ensure that our clinics in the local villages are working. That's one thing. Thank you very much.
All right, Clinton from Bori, thank you. Dr. Vetty, what do you have to say?
Thank you, Kalada.
Yeah.
I think he got me wrong. We are starting with our public facilities. Before we opened up enrollment, one of the first things we did was to do an assessment of the facilities. And so we started with the public primary healthcare facilities. Why I mentioned private facilities was to say that because people are going to be paying, if they are not getting quality service from the public, they have a right to choose wherever they want to access care. Now, government is also doing a lot to renovate, to equip, and to get health workers. For you to have quality service, what you need is a facility, and the buildings are there. They need to be to be up to standard. They need equipment, and then you need the requisite health workers to work. And all of those, Governor Siminalayi is doing them. Okay. He has even gone beyond the primary level care to make sure that not just the primary care, but the general hospitals which are close to us at the LGA levels are being looked into. So I think that this government is strategic. The Honorable Commissioner for Health has been very instrumental to all of this, and she's advising the governor in the right way to ensure that really no one is left behind in ensuring health for all people in Rivers State.
All right.
So yes, government is working on making sure that public facilities are up to standard to be able to provide the care that people need. And government is employing, he has asked that 1,000 health workers be employed just this year. And so, before now, you know, doing the no. But now, so we believe that going forward, we have the health services and the people at the government level.
Someone asking, does the health insurance thing in any way connect to the government National Health Insurance Authority?
Absolutely. Mention about the basic health provision fund. I think the joy for me there has been the National Health Insurance Scheme. Recently we have the National Health Insurance Act, and now they are free. Now health to be on the government where states will legislate and the federal will legislate on health. But let's say the new health insurance act insurance goes from the non-current to the receiving, meaning it's now what's legislated the national that has to be to the state. So the decide to go in another direction when the national is going in another direction. And for the National Health Insurance Authority is health for all Nigerians. That's what Rivers State has brought into that, talking for all rivers. And so as part of the National Health Safety, there is a fund that takes care of vulnerable population. And I talked about the federal government through the National Insurance to bring transfer funds, states will bring transfer funds, and do what takes care of vulnerable population as an element. So yes, we are working with the national. Yes, we cover 6-7 million plus states. That's to the health insurance of the country. Actually, was universal health coverage in Nigeria.
All right. So someone is asking, subscribers have a choice of the facility to use. That's coming, George. You've just about the public health facilities being remodeled, worked, and workers. But it can be in the rural areas and in the urban areas. Choose what big facility to use.
Facility assessment for the public facilities. We are going to do something with the private facilities. We are getting out information for people to come and sign up with us to say, we want to join your scheme. We want to be able to take care of lives under your scheme. And that process is ongoing. So as many private health facilities that are registered with the Rivers State Ministry of Health, Department of Medical Services, because those are the facilities that are known as private facilities that are functional in the state. Once you pass through all of those hurdles, you can be one of the facilities where people can choose to access health care in Rivers State.
All right. Someone said, someone's asking, hope this scheme will not be compulsory for civil servants because this will be an excuse to further cut the little salaries paid to civil servants who their monthly payments cannot buy one bag of rice. Uzoma with that one. So, would it be compulsory for civil servants?
You know why I'm laughing?
No, you tell me.
I just told us that health insurance is on the exclusive list, meaning that it is compulsory, really, for everybody. It's not just whether you're a civil servant or not.
Okay.
It's important that as Nigerians, that we are covered under a form of health insurance. Canada,
Okay. Yeah.
I heard you say something about having an experience.
Yeah.
Today, someone called me to say, oh, she heard something on air about health insurance. She's so excited because she witnessed where someone went to the hospital and because of 1,000 naira, nothing could be done for that person. So I look at myself, I am a civil servant, all right? And I know how much I spend, not just for my family members, but for people, relatives, that have to go out there for one illness or the other.
All right.
And so for me, if all I need to do per annum is to pay a token of 15,000 to cover one life, and so anytime they call me, they are ill, I said, you remember you have a card, go to the health center. I think it's a lot better and cheaper and more affordable for me as a civil servant than for me to bring out money. I went to a clinic today. We bought a card for 20,000 for that person. It was a specialist clinic. But do you know that with health insurance, you go to your primary care provider. Whatever is covered under that care is capitated for. And if you're referred for a specialist service, it is covered with your meager amount of money. Nobody asks you for an extra cost. If you have malaria as many as 6 times, you get treatment. Canada, you know how much anti-malarial is. So I think that as civil servants, we should be excited. We should be asking, when will this thing come to us? When will you start, allowing us to contribute so that we can cover not just us, but our spouses and 4 of our children that are less than 18 years.
All right.
So I want to encourage the person that asked that question that it's better that a token is taken from my salary and my health and that of my family members is covered than for me to pay out of pocket all the time when my children are ill or when my spouse is ill.
Okay. Keep those calls coming in. I'd like to hear from you. 0817-923-0002, 0817-923-0003, and 0817-923-0007. Also, you can send in your WhatsApp messages to the number 0809-0306-416. What questions do you have? Also, what contributions do you think you can make so that the scheme or the program can really be sustained and for the good of Rivers people? 0817-923-0002, 0817-923-0003. Remember, we're live on Facebook as well, Nigerian for PH. We are live on YouTube as well, Nigerian for PH, and we are active on X, Nigeria Info PH. All right, let's take this call. There is a call now. What's your name? Gift from Yenigua. Gift, welcome. What is on your mind? I'd like to hear from you.
Kalada, my brother, thank you.
Yeah, welcome.
As far as I'm concerned, this is a wonderful gist of grant.
Okay.
Let me even thank your guest who is trying to enlighten the public.
Okay.
Yes, I know the importance of this. So I can assure you, this is the best thing that has happened to Nigerians and Rivers people by anywhere you find yourself.
All right.
Especially the state partnering with even the federal government. That is what even Ali Party talked about of recent, trying to educate the public. So here in Bayelsa, the challenge we are having, it is here, it is existing. It started under Tiraki Dixon, the immediate past governor before this one, Doyediri. The challenge, the House of Assembly has summoned the state government and the body that is in charge of this health insurance here in Bayelsa. Because why? A situation where Canada, you go to the hospital, ordinary paracetamol, they will tell you they don't have. But when this whole thing started, everything was going smoothly. I don't know if it is this new administration. That is the area you're talking about. That is why I say, what is the topic?
All right.
The sustenance of it is the challenge, is the biggest headache and problem. But I am telling you, this is the best thing that has happened. Because at times when you don't have anything, that is when sickness will come. you go to that hospital and get free treatment. I call it free because you're not paying out of pocket.
All right.
You are not paying a dime.
Okay.
So it is very important. It is very good. And the initiator of this thing is who I want to say thank you to, which is everyone here from UK.
All right. Thank you, Gibbs.
When initiated this thing, I am telling you, and now team has carried on with it. This is what we call consolidation and continuity. What to be fighting. Thank you.
All right. Thank you, Gibbs. I've got to move on now. I've got Godspar from HA. Godspar, welcome. What is on your mind?
Canada, good evening.
Yeah, greetings to you. Welcome. What's on
Yeah. It's a laudable project, pension health scheme.
Okay.
And my fear is the accessibility. Will everybody be accessible to the scheme?
Okay.
The formalities. I think the guest is there hearing me.
Yes, she is.
Whether it will be hijacked. By the well-to-do in the university.
Okay.
What the less privileged will not have access, they'll be just looking at it as a mirage. And again, my fear, like what we had in a contributory pension scheme, which we did and it failed, who are going to be the managers? It's a laudable project. My fear are these ones I'm saying, whether the guests will answer these questions.
All right.
Questions and other ones I'm going to ask because governor is a person who initiated it, or the federal government, I don't know where it's coming from. People of that state, if it is well managed. And again, I think...
summarize, please.
Summarily, the health, the zonal hospitals are not functional. One, they have not finished another area.
All right.
When you want to access all these things, you have to get some to the grassroots.
All right, then.
Accessibility of the hospital so that you can get these things. Because it will not be in Port Harcourt only.
I think we've answered some of those questions.
Will be a
Godspar
point for the less privileged.
Okay.
And she is working. And I want to get to answer some of these questions. Thank you. God bless you.
All right. Thank you very much. Real Gift from Port Harcourt Township. Welcome. What is on your mind, please?
Good afternoon to you,
Yeah, good afternoon.
Chief K, we are told in my community that the grow big set of it is not a problem.
I didn't get that.
Challenge.
I didn't get that. You said what?
I said in my community, to grow big set of teeth is not a problem.
Okay.
But the challenge is to grow the size of lip that will cover that teeth for you.
Okay.
This is a laudable project. I agree with you. But Paraventure, who are in this program, and then maybe I choose a particular facility, and I go there, maybe they look at me and check and whatever, and they now tell me that the drugs prescribed for me is not there. What happens then, please?
All right.
That's one. And two, the enrollment is it for preterm work, whether you are working or not. And if that be the case, I think they should also look at the amount to be contributed. So at least it's fair for
I think we've answered that question, but I'm going to let her answer all over again. But thank you, Real Gifts. I've got to go. I've got Ida from Inkoro. Ida, welcome. What is on your mind? Yeah.
This scheme, I want to commend the governor of Rivers State.
Okay.
Across the 23 LTA,
it's River State.
Drive down to Bori, and I want to plead with the governor. Please, the Bori also, the general, please.
All right then.
Please open it for us.
All right then.
We'll run down to here. So from Inkoro to Bori is very far.
All right then.
The governor should please open that place and try to put up our own health system in our local government, please.
All right.
It should be across all the local government, please. So the woman should answer the question. Thank
all right, Ida, thank you very much. Dr. Vetty, Agala, so many questions for you on the show. Let's start with the fear of sustainability in terms of availability of drugs. What do you say about that? So I go to the hospital, I'm going under the scheme or the umbrella of the scheme, and they say to me that drugs are not available. What do I do?
All right, thank you very much. Yes, indeed, so many questions. And for me, it's a good thing because people are interested. Do you know that Rivers State is the last state to be onboarded for health insurance?
Okay.
fine cancer scheme. That has had health insurance for more than so it's not a new thing, and we are here. Capital is our subscription. You know, give us a of doubt. If you go to the hospital, you get a medication. Remember that.
Pause.
After this. Ladies, I need to do something to squish up your and I know this marketer. You have this all one place for your kids to show up in there.